Today we have conducted here a rally at Osmania General Hospital, mainly to demand the government for the construction of a new building so that it can be beneficial both for the public health as well as to the newly recruited doctors. What is a harm with the present pitiable state of the building? That is what I emphasize. First point is,
it's a historic building, but still the patient services needs to be improved. Hence, we demand for a better building for better patient care services. Thank you.
Especially like in the orthopedics department, we have started doing the total knee replacement services at the free of cost under Ayushman Bharat scheme. But at the same time, those services, professional services, are improving a lot. The infrastructure of the hospital is not up to the mark. So we are expecting.
The only complaint I have is about the building, and if the building were to improve, we have an old building, we respect the building, it's a heritage building, I do understand, but for patient care we really need a nice building.
by improving the architecture as well as by improving the general health of the public, more and more patients will get admitted, and thereby more and more PG students will want to get admitted in this hospital.
So I request our Telangana government, our dynamic CM KCR sir, to construct Osmania hospital new building.
Hospital has a highest outpatient number, but
now the infrastructure development is not matching with the services that are being provided by all the doctors.
Good building so that doctors can work safely and conveniently and give patients what they need.
I have studied here in the new building and the old building. I really think we need some better infrastructure.
Yeah, it's really important the government takes notice of this and constructs a new building.
ఉస్మానియా హాస్పిటల్కి ఒక ప్రత్యేకమైన బిల్డింగ్ అంటూ లేదు ఇప్పటి వరకు. పాత బిల్డింగ్ మూసేసిన తర్వాత పేషెంట్స్ ఎన్ని కష్టాల ద్వారా వచ్చి అడ్మిట్ అవుతున్నా కానీ మేము మన డాక్టర్ల నుంచి కరెక్ట్ ట్రీట్మెంట్ అందుతుంది, కానీ ఓన్లీ పేషెంట్స్ అంటే సరిగా ట్రీట్ అవ్వలేదు అండ్ ఏదైనా చనిపోతున్నారు అంటే దానికి కారణం మెయిన్గా బెడ్స్ లేకపోవడము అండ్ పేషెంట్స్ ఉండడానికి స్థలం లేకపోవడము. సో మనం గవర్నమెంట్ నుంచి మేము కోరుకునేది ఏంటి అంటే అనవసరమైన వాటి మీద ఖర్చు పెట్టే కంటే ఒక కొత్త హాస్పిటల్ మన ఉస్మానియాకి ఇస్తే ఎంత ఇంప్రూవ్ చేయగలమో అంత ఇంప్రూవ్ చేయగలము హాస్పిటల్ని. దాని ద్వారా పేషెంట్స్ యొక్క లైఫ్ని సేవ్ చేయొచ్చు అని నేను ఆశిస్తున్నాను అంతే.
Everyone, I know this building is very beautiful, but there is also beauty in giving patients the best healthcare also. So I think government should concentrate on that part better and provide all the patients good health care by giving us a good building so that doctors can work safely and conveniently and give patients what they need.
Hello. Yeah, actually, nowadays we are getting more and more number of patients to the Osmania General Hospital because of the introduction of the Ayushman Bharat scheme, but the new services have been begun for which more and more number of the patients are coming to utilize that services. Especially like in the orthopedics department, we have started doing the total knee replacement services at the free of cost under Ayushman Bharat scheme. But at the same time, those services, professional services, are improving a lot. The infrastructure of the hospital is not up to the mark. So we are expecting a new building so that furthermore number of the patients will come to the Osmania hospital to utilize the services. So we expect the government will initiate action to construct the new building in the place of the old Osmania General Hospital.
Hello everyone, I'm Dr. Pravalika. I'm working as an intern here in this Osmania General Hospital. I have studied here in the new building and the old building. I really think we need some better infrastructure, better beds, everything for the better patient care. Actually, after seeing the old building and how the patients are shifted from this nice space to a very congested space, you'll also see how different in the patient care is.
Hello, this is Dr. Manisha Sahai. I am Professor Head of Department of Nephrology at Osmania Medical College. I am a proud student of Osmania Medical College. I have finished my post-graduation in Osmania, and I really feel for the building. In Osmania, a lot of work goes on. We do kidney transplants. We have finished 700 kidney transplants so far, though nobody would believe it seeing the building. And we have done around 70 cadaver transplants also from brain dead donors. So we are proud that we are able to provide all the services, including high-end service like transplant. We do daily around 100 hemodialysis per day. We do peritoneal dialysis. We do CAPD. We do procedures for children, for adults, for geriatric population. Our OP is roughly 100 plus per day, and we have an inpatient load which is always full. We have 15 postgraduates whom we train. So the software of Osmania is very strong. All the high-end services, thanks to the government of Telangana, we are able to provide free of cost for the patient. In fact, Osmania was the first government hospital in the state to do a multi-organ transplant of simultaneous kidney pancreas transplant in a type 1 diabetic patient with kidney disease. The only complaint I have is about the building, and if the building were to improve, we have an old building, we respect the building, it's a heritage building, I do understand, but for patient care we really need a nice building, and if we get to work in a very nice ambience, that boosts the morale for us. We have lots of UG teaching, we have lots of PG teaching, we have so many super specialty seats as well. Many of the consultants working in different hospitals across Telangana, in India and abroad, are products of Osmania. So I just wish my alma mater looks more beautiful and the patients also get attracted seeing the ambience of Osmania. So I hope from the bottom of the heart that this message goes across and we get a new building with modern infrastructure. We are determined to work better and improve the care for the patients, the poor patients of Telangana. From our side, you will not find us lacking. Only thing, kindly help us with the new building. Thank you.
Hi, this is Dr. Savita from 2K17 batch. I am working as house surgeon here. Our hospital has a highest outpatient number, but
Osmania General Hospital is a very important and prestigious hospital for this part of the country, and it has been in operation since more than 100 years now. And no wonder we see that now the infrastructure development is not matching with the services that have been provided by all the doctors who are providing great service to all the patients of this part of the country. Not only this part of the state, but from the neighboring states also we see a lot of patients coming here. We have a huge inflow of patients every day. We have more than 5,000 patients coming to our OP in Osmania General Hospital, and in endocrinology OP itself we have about 350 or 400 patients coming every OPED, and we have a huge number of admissions. And today, because a large portion of the building is not being used, we are having a great difficulty in accommodating all the patients. We request the administration and we request the government to provide us a better facilities, better infrastructure, so that we can provide even better services to our patients. We are doing our best in the available infrastructure, and we need more space to sort of improve our facilities. And this is our request to the administration and to the government. Thank you.
Osmania Medical College is a very long-standing Osmania college. Here, 250 medical students will be there every year at a given point of time. 1,000 medical students and 600 and change postgraduates should be there. All faculty, doctors, most of the here maximum services are given. Here all transplant surgeries, liver transplants, kidney transplants, pancreas transplants we have done. All invasive procedures will be done in Osmania General Hospital, but we need a very good hospital. It is very 100 years old building. It is not giving proper services. All the facilities are not available in this hospital for the medical students, for the faculty and for the staff. So for better equipment and everything is okay, but better facilities are needed for this hospital. So for that, new Osmania General Hospital has to be constructed to meet the demand of the medical students, staff and faculty and everybody. It should be an icon in Telangana, so that because lot of work can be done in Osmania Medical College, because all the doctors are available, all specialties are available in Osmania Medical College. So to promote them, to take their services effectively, new building construction is the need of the hour in Osmania Medical College. So I request our Telangana government, our dynamic CM KCR sir, to construct Osmania Hospital new building to meet the better services for the poor patients, as well as the better medical education for the medical students and postgraduate students. Thank you very much.
Mainly, it causes a lot of damage to the patients who are already admitted. And not only that, the patients who are about to get operated are also unable to get admitted in the wards. That is the main reason that we want the already existing old building to be demolished and we want a new building to be reconstructed in that space, so that whatever taxes that are being paid to the government will not go in vain, but rather it will be utilized for the empowerment of the public health. So next thing is I want to emphasize that many newly doctors who are already passing the All India NEET counselling are unable to join here mainly because of seeing the pitiable sight of the building. So by improving the architecture as well as by improving the general health of the public, more and more patients will get admitted and thereby more and more PG students will want to get admitted in this hospital. So by already improving the architecture of the building, and not only that, by increasing the name and fame of the Osmania, which has a brand in itself, we will not only be able to do justice to the general public, but also we'll be able to do justice to the student community, because more and more doctors will be feeling like to attend and join in this great Osmania hospital. Thank you.
Hello to all the viewers. I am Dr. Mallikarjun. I am one of the house surgeons at this historic Osmania General Hospital. I have been visiting this hospital since the last 5 years, and I can tell you that this hospital is really in need of some upgradation, because right now with the facilities that we have, we don't need the demands of the people, and also we are unable to deliver on the promised quality care services that the patients need. So especially since the closure of the old building following the floods, and right now this hospital really needs some upgradation. I know this is a very old building, historic building, and these historic places really are connectors of the past and present, and they need to be preserved. I understand that, but it is also important that we maintain the patient care quality services, and